Can seniors lose their Medicare benefits? Breaking news for seniors and their families. The question on many minds today is, can seniors lose their Medicare benefits? With recent discussions about health care, this topic is more relevant than ever. If you or a loved one is approaching age 65 or has questions about Medicare, this is the time to get informed. Once seniors qualify for Medicare, typically at age 65, their coverage continues as long as they meet basic eligibility requirements. This includes being a citizen or legal resident and paying premiums for certain parts of Medicare. It is important to note that seniors do not lose benefits simply because of age or health changes. However, there are some important factors to consider. For Medicare Part B, which is medical insurance, and Part D, which covers prescription drugs, beneficiaries must pay monthly premiums. If a senior fails to pay these premiums, their coverage can be suspended or even terminated. This is a primary way that benefits could be lost or paused. Seniors who choose Medicare Advantage, also known as Part C, or Medigap plans must follow the rules of those private plans. If they do not pay premiums or violate plan rules, they could lose coverage through those plans. However, their original Medicare coverage remains intact. Some seniors qualify for both Medicare and Medicaid. Medicaid offers additional benefits, such as nursing home care, that Medicare does not cover. Changes in Medicaid eligibility or state budget cuts might affect these additional benefits, but not Medicare itself. If a senior loses Medicaid, they could face higher out-of-pocket costs for services that Medicare does not cover. While Medicaid has faced work requirement policies in some states, these do not apply to Medicare. Seniors on Medicare are not subject to work requirements to keep their benefits. However, changes in federal or state policies could affect coverage options or supplemental benefits. Seniors must also stay attentive to communications from Medicare or related health plans. Failure to respond to requests for information or re-enrollment in certain programs could lead to loss of specific benefits or subsidies. In summary, while Medicare benefits for seniors are generally secure once enrolled, failure to pay premiums or meet administrative requirements can lead to loss or suspension of some benefits. Medicaid-related benefits and supplemental plans may be more vulnerable to policy changes, but original Medicare coverage remains stable for eligible seniors.